To see you
Good
again.
to see you again.
Yes,
Hi, Mrs.
seeing
Wilson.
you.
Ms. Wilson. My name is Antonis Pratsos. I'm an interventional cardiologist, and I'm the chief of the cardiovascular laboratory at Bryn Mawr Hospital. So I treat patients with chest pain, heart attacks, chronic stable angina and stable angina. I treat patients with peripheral arterial disease. I perform procedures with relation to heart blockages, coronary artery disease. I also perform peripheral arterial disease interventions. There are different modalities to treat coronary artery disease or heart disease in general. Medication is the mainstay, but in addition, some people need extra. And that extra can be wires, catheters, balloons, stents. And that is the least invasive method of providing that extra avenue for treatment for the patient. A common intervention in my field is the placement of a coronary stent. It keeps the artery open and the patient gets relieved of their angina. I treat patients that come for procedures and there's almost always a relative next to them, and it's really important to have the conversation of what we're going in for and what we're trying to achieve before the procedure, and also have the conversation of what we were able to do right after the procedure and what to expect going home with that caregiver. At Mainline Health, we have cardiovascular treatments that are not available in other hospitals in the region or in the country. Being part of the Lung and Heart Institute, we get a lot of research studies in both coronary and peripheral arterial disease, and therefore we're on the cutting edge of the technologies coming out. This helps that patient because of access to therapies that they may not otherwise have available to them. In addition, it tells them that that physician is on the cutting edge of their field and that they are striving towards something better in that field. The ability to help patients to do things that were otherwise impossible to them is what drives me to keep doing what I'm doing.